Maalox Suspension. The drug has been absorbing and enveloping effect, due to which the impact of damaging factors of the mucous membrane of the esophagus and stomach is reduced. Indications: peptic ulcer of the stomach and duodenum in the acute phase, chronic gastroduodenitis with normal or increased secretory function in the acute phase, acute gastroduodenitis, hernia of the esophageal opening of the diaphragm, reflux esophagitis, phenomena of dyspepsia and their prevention, resulting from the use of certain drugs, discomfort or pain in the epigastrium, heartburn with errors in diet, excessive consumption of coffee, alcohol, nicotine. How to take, course of administration and dosage. Inside: adults and children over 15 years old, contents of 1 to 2 packets, 50 to 30 milliliters, 1 to 1.5 hours after eating or when heartburn occurs. Before opening the mini package, gently mix the contents of the package by kneading the package between your fingers. Squeeze the contents of the package into a spoon or into the mouth. Take the suspension without prior dilution. If necessary, you can take an additional dose of the drug 2 hours after the previous dose. The maximum daily dose is 12 packets, 180 milliliters. The course of treatment should not exceed 2 to 3 months. With occasional use, for example with discomfort after errors in the diet, take 1 to 2 packets, 50 to 30 milliliters once. Contraindications: severe renal failure, hypersensitivity to active substances and other components of this drug, hyperphosphatemia, intolerance to fructose, due to the presence of sorbitol in the preparation, children and adolescents up to 12 years of age. Special instructions: a 2-hour interval shall be observed between taking Maalox and other medicines. When prescribing the drug to children, the dosing regimen is set individually. The use of the drug in children under the age of 12 years is not recommended without consulting a doctor. Side effects: immune system disorders, hypersensitivity reactions such as pruritus, urticaria, angioedema, and anaphylactic reactions, gastrointestinal disorders, infrequently diarrhea, constipation, metabolic and nutritional disorders, hypomagnesemia, hyperaluminemia, hyperphosphatemia, which can lead to increased bone resorption, hypercalciuria, osteomalacia,